name is Michelle McCracken. I'm a student nurse. The skill today that I'm going to be demonstrating is a female Foley catheter. So the first thing that I'm going to do before I go into the patient's room is complete hand hygiene. I'm going to introduce myself to the patient. I'm going to explain to the patient what I'm going to do. I'm going to verify the patient's armband that they are who the chart says that they are. I'm going to set up my table. Next thing I'm going to do is I'm going to take my package, and I am looking to make sure that the expiration date is good and that there's no breakage or tears in the package. The integrity is good. And at this point, what I'm going to do, the patient is laying in bed, so I would go up and put on my non-sterile gloves at this point. Okay, I would remove the bedding to expose the patient's legs. I would position them in the appropriate position for the procedure. Again, explaining everything that I'm doing to them. Okay, I would take my sterile box, put it right in between on the bed where the patient's legs are. Okay, I'm going to make sure that I open my package away from me. Before opening the package, though, I'm going to remove my gloves. I'm going to discard them. Hand hygiene. Okay. Open my package. Having a little malfunction with the glove. Since my hand is sterile, this is all sterile here. Okay. Okay. I'm going to open up my iodine packet. I'm going to empty it there. Well, in this case, we don't have cotton balls, so there are 3 swab sticks in here, so I would open this up and position it here so that it's readily available. Okay, and I'm going to take my lubrication and put it in the corner of the box right here and discard that. Next, I'm going to take my syringe with sterile water. And I'm going to attach it. I'm not going to inflate it yet. Going to say that that didn't fall, that it was still connected, so it's still sterile. Okay, the next thing that I'm going to do is this becomes my dirty hand now, so I would be positioned a whole lot better. Here I would be able to expose the labia. I'm going to take my first cleansing stick. I'm going to clean the outer side, discard, take my second stick, clean the other side, outer, discard, take my last stick and clean from top to bottom. Okay, then at that point going to dip this inside the lubricating gel. And again, making sure that I'm inserting into the urethra. And I'm going to insert about 2 to 3 inches. And then what I'm looking for is a flashback of urine. And then once I see that, I'm going to inflate my bulb syringe, which was still attached, 10 cc's, disconnect. And then I'm going to secure the catheter in place. Then I'm going to take my tubing and I'm going to secure it to the inside of the patient's thigh. And then I'm going to hang the bag on the side of the bed on the appropriate railing. Then at that point, I'm going to assemble all of my stuff, discard everything, perform hand hygiene, and provide patient comfort. Lower the bed, pull the side rails up. Thank you.